Hi everyone, welcome back to my YouTube channel Nursing with Beatrice. I am Beatrice and today I'll be going over some questions, Nclex review quiz on some topics we've covered so far: deep vein thrombosis, on antiplatelets, anticoagulants and thrombolytics. Let's begin. So question 1. Which of the factors from Virchow's triad most likely contributes to the development of deep vein thrombosis, DVT, in a client with prolonged immobility? Let's analyze the question. So we know Virchow triad is made up of 3 factors contributing to the development of deep vein thrombosis. And the question now is emphasizing on prolonged immobility. So, first option says endothelial injury. Second one says hypercoagulability. C says venous stasis. And D, platelet dysfunction. We know that A, endothelial injury and hypercoagulability, including venous stasis, are the 3 factors. But which of them will make a patient develop DVT as a result of prolonged immobility when the patient is not active? So will it be endothelial injury? No. Hypercoagulability? No. Venous stasis? Yes. We'll pick venous stasis because stasis has to do with when the blood is not moving or is slowed down as a result of what? Inactivity or immobility. So that would be the best option. We'll move to question 2. He says, a client with a diagnosis of deep vein thrombosis is prescribed heparin. What is the primary goal of this treatment? So now, heparin is an anticoagulant. What does anticoagulant do? Let's look at the options. A, reduce pain and inflammation. No. B, dissolve the existing clot. No, that would be the function of thrombolytics. C, prevent clot propagation and new clots. Yes. D, lower blood pressure. No, that would be antihypertensive. So the best option will be C, prevent clot propagation and new clot. So anticoagulants, when we discuss it, we say it does not break down clot, but it prevents old clot from getting bigger and new clots from forming. So option C will be the best answer. Question 3. A patient who is on warfarin treatment asks the nurse about dietary restrictions. Which response by the nurse is correct? Dietary restrictions, somebody on warfarin. So look at that very closely. A says vitamin K has no effect on your medication. Is that correct? No. We know that vitamin K is the antidote for a patient that is taking warfarin that have experienced overdose. So definitely vitamin K has effect. B, you should avoid all food containing vitamin K. Is that correct? No, we still need those vitamins. C, eat a consistent amount of vitamin K rich food like green leafy vegetables. Yes. Let's see D. Increase your intake of green leafy vegetables to counteract the medication. No, we don't increase the intake of green leafy vegetables, but we eat a consistent amount. Why? Because we know that the antidote to warfarin overdose is vitamin K. So, and green leafy vegetable is a great source of vitamin K. So we don't tell the patient not to eat green leafy vegetables at all, but they should eat a consistent amount so that the healthcare provider will not be changing the medication. So there will be a consistency in the dose the patient is supposed to take. So that's why C will be the best option. Question 4. A patient with a history of pulmonary embolism is receiving heparin therapy following major surgery. The nurse observed that the patient has a blood pressure of 8950 mm mercury, a heart rate of 106 beats per minute, and an APTT greater than 94 seconds. The patient also reports easy bruising. which order should the nurse request to address the patient condition? So let's analyze the question. This patient is having pulmonary embolism and is receiving heparin therapy. We know because of pulmonary embolism, that means there's already a clot that is in the pulmonary circulation that we want to address because it can be fatal. And heparin is an anticoagulant that we can use to take care of these clots, to prevent the clot from getting bigger and prevent new clot from forming, and in a way the clot will be resolved. Now the nurse is observing that the patient blood pressure is now 89/50, which is low. Heart rate is 106 beats per minute high. And the activated partial thromboplastin time is greater than 94 seconds. So for a patient on heparin, the therapeutic range for the APTT should be between 60 to 80 seconds. So if it's higher than that, that means the patient is at risk of bleeding. Now, the patient also reports easy bruising, so the patient is already bleeding. So meaning there's a sign of overdose. So which order should the nurse request? Of course, let's look at the option, switch heparin to apixaban. No. Apixaban is also an anticoagulant, so we are not even looking at that. B, obtain an immediate repeat of APTT test. We shouldn't be requesting an immediate repeat because the first one already told us that it's greater than 94 seconds. We'll do that later after we have addressed the situation. So that will not be the best option. C, administer protamine sulfate. So C, yes, because protamine sulfate is the antidote for heparin overdose. D, start aspirin to prevent platelet aggregation. No, that will also prolong bleeding because patient is already bleeding, so the clotting time will be increased, and we don't want that. So the best option would be C, administer protamine sulfate. Question 5. A patient diagnosed with atrial fibrillation is currently on Warfarin, Coumadin therapy. The nurse reviews the latest lab results and notes that the patient INR is 2.7. Before proceeding with the next scheduled dose, the nurse should. Let's look at the question. The patient has atrial fibrillation and because of that is on warfarin. Now, the INR, international normalized ratio, is 2.7. We say that the patient that is on warfarin, that we want the therapeutic range to be between 2 to 3. So within that range is okay. So before the nurse gives the next dose, what would the nurse do? A, consult the provider about reducing the dose. No, it's still within the range. B, administer the medication as prescribed. I will choose this, yes, because it's still between 2 to 3. If it is more than 3, we may be thinking about reducing the dose. If it is less than 2, we'll be thinking that it's not therapeutic enough, we may be increasing the dose. So B, yes. C, seek approval to increase the dose. No. D, request an order for vitamin K. No, that will not even follow. So the best answer will be B, administer the medication as prescribed. Question 6. A nurse is reviewing a patient history before administering Antiplatelets for an acute ischemic stroke. Which findings would require the nurse to hold the medication and notify the healthcare provider? Select all that apply. So, Antiplatelets is a thrombolytics, and this is used for treating stroke, acute ischemic stroke, also using MI when there's a clot, and of course you want to address that clot as soon as possible. So, which findings? In other words, what are some contraindications to the use of thrombolytics? A, history of hemorrhagic stroke. Yes, we don't use thrombolytics for a patient that already has a hemorrhagic stroke. We use it for ischemic stroke. B, blood pressure of 190/110. Yes, we don't use that. We don't use thrombolytics on it. So it's a contraindication for high blood pressure. C, symptoms started 2 hours ago. Oh yes, so we use that because that option will not be picking that because thrombolytics is more effective when you give it to a patient within 3 hours window. It can extend up to 4.5 hours. So if you started 2 hours ago, it's even good. It will be very effective. So D, recent major surgery within the past 2 weeks. We'll be picking this because it's a contraindication. And D, platelet count of 95,000. Now, platelets, the normal range is between 150,000 to 400,000. So 95,000 is already showing sign that it's low. So definitely we will not be giving a thrombolytics to a patient that have a low platelet. So selecting all that apply or the contraindication to the use of thrombolytics like Antiplatelets will be history of hemorrhagic stroke, a high blood pressure, recent surgery, and low platelets. So the correct answer will be A, B, D, and E. Question 7. A patient with history of atrial fibrillation undergoes hip replacement surgery. On the second post-operative day, the nurse observed a drop in oxygen saturation to 84% along with pruritic chest pain, shortness of breath, and hemoptysis. Recognizing these concerning symptoms, the nurse promptly notifies the provider to report a suspected dash and request an order for dash. We take the question again, we analyze it. This patient has history of AFib and is undergoing hip replacement surgery. The patient went for hip replacement surgery. Now, on the second day after this surgery, the patient, the nurse observed a drop in oxygen saturation, along with pruritic chest pain, shortness of breath, and hemoptysis. What do we think could be happening? So now, what do we suspect in this case? A, myocardial infarction, and said the nurse need to give tissue plasminogen activator. No. Congestive heart failure, the nurse need to give furosemide. No. C, pulmonary embolism, the nurse will be expecting an order for heparin. Yes. Remember, this patient already have history of AFib and now went for surgery. So the patient is at risk of pulmonary embolism. Because of that previous history of atrial fibrillation, it puts them at risk of hypercoagulability, which can lead to pulmonary embolism. So the nurse should be expecting an order for what? It should be suspecting pulmonary embolism. And the heparin, of course, will be helpful, which is an anticoagulant. D, hemorrhage vitamin K. No. So pulmonary embolism will be the best option. Question 8. Why assisting a patient with deep vein thrombosis during a bed bath? A nursing student asked why the patient is prescribed heparin instead of warfarin. Which response from the nurse is most appropriate? So a patient has a deep vein thrombosis. The student is asking why is this patient prescribed heparin instead of what? Warfarin. So for a patient that has deep vein thrombosis, there is already an active blood clot. There's a blood clot that is present. So why do we put patient on heparin, not warfarin? So A, heparin remains in the system longer due to its extended half-life. That's not the reason. Actually, heparin stays shorter because it has a shorter half-life. B, heparin prevents platelet aggregation, reducing the risk of clot formation. No, that will be the function of antiplatelets. C, warfarin has delayed onset, making heparin the preferred choice. That's true, because warfarin stays longer. It doesn't peak easily. So, and we want the one that will address the issue immediately. And that will be what? Heparin. So C is a good option. D, hospital protocol requires starting with heparin before transitioning to warfarin. Of course, that's not true at all. So the best answer would be warfarin has delayed onset, making heparin the preferred choice. That's option C. Question 9. A patient on Coumadin arrives at the emergency department after an accidental overdose. The patient's vital signs are as follows: a heart rate of 68 beats per minute and blood pressure of 114/72. A urinalysis is normal and there are no visible signs of bleeding or hematoma. Nor does the patient report any discomfort. The nurse should anticipate an order for. So you don't want to rush this question because you've heard of overdose of Coumadin. So don't allow Nclex to trick you with such question. Even if the patient says arrive at the emergency with an accidental overdose of Coumadin. But let's look at further information. The patient vital signs says they are normal, they are stable, because it says heart rate of 68, which is normal, blood pressure of 114/72, which is also normal. It says urinalysis is normal and no visible signs of bleeding. That's very important. Patient does not report discomfort. So what should the nurse anticipate? So a PT and an INR test. Yes, we can order for prothrombin time and international normalized ratio test. These are tests we use to check for the level of Coumadin or Warfarin in the system to see if it is normal or outside range. B, protamine sulfate. This one, no. This is for heparin overdose. C, a PTT test. Partial thromboplastin time. This will be for heparin. So no. D, phytonadione. That's vitamin K. So no. So the best option will be A. We'll request for a PT and an INR test just to see if it is within the normal range. For the INR, want it to be between 2 to 3. So even if this patient has taken overdose of Coumadin, we should be expecting to do further tests to see if there's any problem, if the patient is at risk of bleeding. Question 10. A patient in the emergency department presents with stroke symptoms that began an hour ago. Which class of medication should the nurse anticipate administering to address this condition? So we talked about it before, that when a patient is having stroke symptoms, particularly ischemic stroke, within 3 hours window is the best to administer thrombolytic medication. So let's see the option. A, thrombin inhibitor. No, that's an anticoagulant. B, thrombolytic. Yes. C, a direct oral anticoagulant. These are all distractions. This anticoagulant, so no. D, antiplatelet like aspirin. No. So the best option would be thrombolytics. If given within 3 hours, or if it's too long, 4.5 hours window from the onset of symptoms, is effective in breaking down the clots, ischemic stroke, where there's formation of clot in the brain, causing decrease or total lack of blood supply to the brain. Question 11. Which statement from a client undergoing warfarin, Coumadin therapy suggests a need for additional instruction? A, I plan to eat a lot of green leafy vegetables. This one needs teaching. Let's see other options and we'll come back. I will avoid taking aspirin while on Coumadin. Yes, we encourage them to check with the healthcare provider. If possible, avoid taking antiplatelet, NSAIDs and all that when they are on anticoagulant. I will switch to a soft bristle toothbrush. Yes, because they are at risk of bleeding, so we don't want them to use toothbrush that is hard. We want them to use a very soft one. D, I will use an electric razor to prevent nicks and cuts while shaving. Yes, because of that easy risk for bleeding, we encourage them to use electric razor. So the best option is A. We need to teach this patient more that they are not to eat a lot of green leafy vegetable, but they should eat a consistent amount. So the one they are already eating, they should eat that consistent amount so that they won't be changing their warfarin medication all the time. So that there will be that consistency, because if they take too much green leafy vegetables, which is high in vitamin K, it's as if they are taking the antidote, meaning it will counteract the effect of warfarin. Question 12. After administering a thrombolytic drug, which action should the nurse avoid? So, a thrombolytic drug, what are some contraindications, or what we should as nurses not do when a patient is on thrombolytics? So A, giving intravenous medication. Yes, we can give intravenous medication. B, using an electric razor. Of course, we encourage them to use electric razor. Administer an intramuscular injection. So this is a no-no. We don't want to go invasive. So when a patient is on thrombolytic medication, we say no IM medication, no intramuscular medication. D, providing a soft bristle toothbrush. We encourage them to use soft toothbrush. So C is the option. We don't give intramuscular injection to a patient that is on thrombolytic therapy, because we don't want them to bleed too much. Because already thrombolytics, the greatest risk is excessive or massive bleeding. Question 13. The nurse is preparing to administer a scheduled dose of Coumadin when the patient INR result returns at 4.6, what is the most appropriate nursing action? So an INR of 4.6 is high. We know the normal range is between 2 to 3. So what would be the best action for this patient? A, administer the medication as prescribed. No, we won't be giving more because it's already outside the range. The patient is at risk of bleeding. B, request a repeat INR test. Well, that could be an option, but let's see better options if there are. Withhold the medication and notify the healthcare provider. Yes, that would be the best option. So even if they will repeat an INR test, you need to notify the healthcare provider. Most importantly, you shouldn't give further medication. So you need to withhold that dose and let the healthcare provider know as soon as possible. They can decide to do a repeat of the test. They can decide to give maybe vitamin K if they see that the patient is bleeding and all that. So of course, very important, the option C is the best. D says evaluate the patient for signs of warfarin overdose and proceed with the administration. So now we will do evaluation of signs of warfarin, yes, but to not still stop us from withholding the medication and letting the healthcare provider know. And if you see the clause with this question of D, it says and proceed to give the administration. So we are not even going to give. The INR is too high. Question 14. The nurse is educating a patient on the difference between anticoagulants and antiplatelets medications. Which of the following medications are classified as antiplatelets? So select all that apply. A, dabigatran. So dabigatran is anticoagulant. B, aspirin. Yes, aspirin is an antiplatelet. C, rivaroxaban. So this is also an anticoagulant. D, fondaparinux. So this one is also an anticoagulant, is a factor SA inhibitor. E, ticagrelor. So now ticagrelor is an antiplatelet. So they say select all that apply for those that are classified as antiplatelet. So the option will be B and E, aspirin and ticagrelor. Question 15. A nurse is assessing a patient receiving subcutaneous heparin for deep vein thrombosis prevention. Which findings indicate a potential complication requiring immediate intervention? Select all that apply. So this patient is receiving heparin to prevent DVT. Now, which finding will indicate potential complication? A, new onset of dark taris 2. Yes, this is something that the nurse needs to address. It indicates a potential complication of bleeding. B, sudden drop in blood pressure. Yes, this will also indicate a complication like bleeding, because when the blood pressure drops, that means there could be an internal bleeding. So the nurse needs to take note of this. C, small bruising at the injection site. No, this is not a complication. Actually, when patients take heparin, they are likely to have a small bruising at the injection site. So that's not a complication at all that will need intervention. This, severe headache or confusion. Yes, this could be a complication. It could be signal hemorrhage to the brain. D, petechiae on the chest and arm. So petechiae is either red or purple spots underneath the skin. That could be a sign of heparin-induced thrombocytopenia. So option A, new onset of dark taris 2. B, sudden drop in blood pressure, which could show a sign of internal bleeding. D, severe headache or confusion. And E, petechiae on the chest and arms are potential complications that will require immediate intervention. So that wraps up today's review of Nclex question on anticoagulant, antiplatelet, thrombolytics, and deep vein thrombosis. If you find this video helpful, please like, share, and subscribe for more educational content. Thank you.